I'm Dr. Shrikant Ambalkar. I'm one of the consultant microbiologists here. I'm working here for last almost 10 years, and I'm currently the head of service for microbiology. Yeah, so as you know, infections or infectious diseases are still a significant cause of problem of mortality. We do see a lot of patients dying of infections, and you must have heard about sepsis and some other new and wonderful infections. As a microbiologist and as a service, microbiology service, we help our clinical colleagues in diagnosing, investigating, and advising on treatment for these infections. So we also are involved in advising on prevention and control of these infections, because that is also an important part. And you must have heard about this new emerging and re-emerging infections like coronavirus, which is causing a problem now. Previously we had SARS epidemic, then MERS, like Middle East Respiratory Syndrome virus, and Ebola virus, and this is an increasing list. And there's another issue with which is a global issue, like spread of antimicrobial resistance, which is it's a huge global problem, and we haven't got much ammunition to sort this problem. So we have to use our current existing antibiotics wisely and effectively to delay the spread of resistance. So because of that, our role as a microbiologist is quite important, because we have to advise and we have to provide education and training to the clinicians regarding treating these multi-drug resistant infections, which is a huge problem. We in this hospital, we got a very fantastic setup here, microbiology laboratory setup, and we got all new technology which gives us results quickly, like antibiotic sensitivity. We got some instruments here in the lab, which has helped us to give the antibiotic sensitivity result quickly, so that we can use that for the treatment of patient. Sepsis was a big problem. The sepsis mortality was quite high in this trust a few years ago, and so how we help as a microbiology team is the most important thing to manage sepsis is early diagnosis and early treatment, and that's where the microbiology department or the microbiologist and the laboratory helps in getting early diagnosis, early treatment. So that's and as I mentioned one of the previous example, the blood culture pathway. We have developed the blood culture pathway, and we want to churn out the result as quickly as possible, so that the clinician on the front door, they get advice for appropriate treatment, and that's what we do.